Hello, and welcome to this special Social Sciences Week event, Ethical Data Science for Social Impact, hosted by the Institute for Social Science Research at the University of Queensland. I'm Mark Weston, the Director of the Institute for Social Science Research. I'd like to begin by acknowledging the traditional owners and their custodianship of all the lands on which we meet today. On behalf of the Institute for Social Science Research at the University of Queensland, I pay our respects to their ancestors and their descendants who continue cultural and spiritual connections to country. We recognise their valuable contributions to Australian and global society. I'd also like to acknowledge other First Nations peoples everywhere. Recent developments in the availability of data and new methods such as machine learning offer great promise for helping to address some of the most pressing social issues in areas such as health and human services. But how can we do this in a way that is beneficial rather than harmful, and is also inclusive and accountable, actively engaging with end users and impacted communities? In ISSR, we're working to build our capacity in ethical data science for social impact, particularly the implementation of machine learning tools in high-stakes government systems for operational and policy purposes. This work is led by ISSR's Professor of Social Data Analytics, Rhema Vaithianathan. Rhema is also Professor of Economics at Auckland University of Technology, where she is the founder and the co-director of the Centre for Social Data Analytics. In 2019, in collaboration with AUT, we established a site of the Centre for Social Data Analytics in ISSR. And since then, we've undertaken a number of projects for and provided masterclasses and more intensive training to government representatives at senior executive and director level in social data science in the public sector. Rhema Vaithianathan is a world leader in the implementation of machine learning tools in high-stakes government systems such as child welfare. She leads international research teams that developed and continue to refine two currently implemented child welfare predictive risk modeling tools, the Allegheny Family Screening Tool in Allegheny County, Pennsylvania, and the Douglas County Decision Aid. Rhema's work has been published in the top journals, profiled in media outlets, including the New York Times and Nature News. She's held research positions in Australia, Singapore, and the United States, including a Harkness Fellowship at Harvard University. We hope you'll find today's webinar interesting and thought-provoking, and also that you'll come away with some ideas about the promise of data science for difficult challenges in human services. I'd encourage you to engage with our speakers through the Q&A panel that you'll see at the bottom of your screens. You can submit questions and comments to the panelists at any time through the Q&A panel. If you're having any difficulty with the sound, please also use the panel to let us know this. I'll now hand over to Rhema.
Thanks, Mark, and thank you very much for joining us today. It's a pleasure to see you all. We've got quite a lineup of a lot of members of our research team. So if you get sick of my voice, it'll change very soon and you'll have another voice to hear. So I'm going to talk you through one of the use cases that we have. One of my passions is actually what's called translational research, which is putting research into action. And I recognized very early that we could develop lots and lots of ethical guidelines for the use of machine learning tools in human services, in high stakes decision making. But if no one was out there modeling what good looks like, what ethical looks like as much as we can, then we don't have a template. And so what our research team and all the collaborators around the world that are part of our community are trying to do is to sort of model what good looks like and share that with other people, and sometimes model what bad looks like and be very open about the mistakes we've made. So I'm going to talk through some of the use cases in child welfare. And as you know, unfortunately in Brisbane, this is also a truth, is that quite regularly we're seeing on the front page of our newspapers terrible stories about failure of child welfare protection services to stop and address some very terrible and traumatic child abuse and child maltreatment events. Unfortunately, what has tended to happen in countries like Australia, New Zealand, and the US is when these front page articles come out, the system has tended to try to encourage and in fact legislate sometimes more people to call in what they see around their neighborhood, to get teachers to call in when they suspect there's a maltreatment happening with children in their class. And as we widen the front door of child welfare and child protection, what tends to happen is we just get lots and lots of children being called in. For example, in the US, every year there's about 3.6 million annual child abuse referrals that are happening to counties and states across the country. The frontline workers who triage these calls are required with very short time frame and quite minimal data sometimes and information to try to decide which case requires further investigation and which doesn't. Getting it wrong on both sides can be quite bad. If you unintentionally and unnecessarily investigate families, you're burdening them with quite awful situation of being investigated for abuse and maltreatment that they are not guilty of. On the other hand, if you fail to do that, you end up with children who might end up being maltreated, and actually you have had an opportunity and failed to act. Because of this high stakes nature and because of the fear that we end up not missing things, 1 in 3 American children have been shown to be investigated by child protection by the age of 18. And before you become too complacent that in Australia we don't have similar numbers, the most recent data we know from South Australian data linkage is that about 1 in 5 Australian children are referred to child protection before they turn 18. So our numbers of children being put through the child protection system are huge, and at the front door of those systems it's almost a kind of a roulette wheel about who gets further dragged into the system and who doesn't. On the other side, we also see that almost half the children who end up in the US with a maltreatment critical event have never been contacted by the child protection system. So what we wanted to do is see if using data better and smarter can help the triaging of those frontline decisions. And what we started working on in 2014 is a predictive risk modeling. Predictive risk modeling basically is a fully automated approach to helping support this very crucial decision. It's fully automated, so unlike structured decisions, the worker who's trying to make that triaging decision doesn't have themselves to enter data into a system. The system basically extracts data about the family and the various members of the referrals that's already known. It uses routinely collected data and it generates a risk of adverse events. So the types of tools we're using, for example, will generate the probability that the child who is being called will, in the next 2 years, have such grave fears held for their maltreatment that they will be removed from home and fostered. So this work really started, at least for me, and this is probably the first paper written on the subject of the fact that we have so much data now that we can predict maltreatment and abuse, in a 2013 article that we wrote, which showed that there was a theoretical possibility of being able to predict abuse and neglect, at least abuse and neglect as recorded in the administrative data systems. Subsequent to the 2013 work, we've deployed, and Mark said it's actually, we've now got about 5 predictive risk modeling projects, or 6 actually tools in use. The ones that I will talk about today are ones that we're working in Colorado, and Diana will talk about one of the tools from Pennsylvania called the Allegheny Family Screening Tool. So how does the Colorado decision tool work? When the call comes in, the calls are usually include, or for some time is spent by the call taker in establishing all the different people who are associated with that call, including mom, dad, alleged perpetrator, and so on. What the data system then, the tool then does is goes and takes all the identities of those people, and using existing child welfare data systems plus benefit system, goes and finds a variety of features or predictors from that list of clients. And by doing that, it then builds a prediction for that particular case. The prediction, and this is an this is the screenshot of the tool that's being used in a county in Colorado. The prediction is just shown as a score of 1 to 20. 20 being that the child is at highest risk, 1 being the child is at the lowest risk. And what they do is they enter the referral ID. Within a second, the score comes up. So of course we want to know how predictive is this score. And so what we did is we built the tool on state level data, and then we held back a bunch of referrals from historical data that we could test the tool on to see how well does this tool do. And in fact, the tool does reasonably well. It's not 100% accurate. If it was 100% accurate, only the children who scored a 20 would end up being removed because of fears of maltreatment. We find that those who score a 20, half of them get removed. Those who score 1, only less than 0.5% of them get removed. So it's still quite discerning in its ability to separate out the high risk from the low risk. And in fact, we've got a project in California, and we get very similar predictions. There we have a score of 1 to 10. When we look at the children and follow them in the data, we see that the children who scored a 10, 60% of them get removed, and those who score a 1, about less than 0.1. In California, because it's a big state, we could also look at children who died or nearly died of maltreatment, and we find the score is also sensitive to that. We also got a paper coming out in JAMA Pediatrics next month, which shows that these tools, although we are predicting removals, are also incredibly sensitive to things like any injury hospitalization, maltreatment hospitalization. They're also sensitive to suicide and self-harm hospitalization when the children get older. So they're sensitive, and they are able to prioritize those children who require services and who are going to have a poor outcome. But when you look at cancer deaths, cancer hospitalization, there's no correlation. So the bottom line is really, and what today's talk is about, is this sort of a quick trip through the data analytics. You can see that really these sorts of tools do seem quite valuable. They're certainly shown to be better than just a person on their own in being able to discern who might be at high levels of risk of harm. But the question is, we might now have this technology, but should we use it? And if we use it, how do we use it ethically? And so our research program that we're going to talk about today is really about the elements of an ethical data strategy. And really, we're going to concentrate today on the elements that we think are least we feel least confident about, that the research frontier really needs to push out on. So when typically we think about ethics, we think, at least in our research group, we think about requiring a good agency leadership who understand what they're doing and why they're doing it and can explain that to the community. We think about a strong community voice. We think about transparency and fairness. We think about a multidisciplinary team doing this work, not just domain experts, not just computer scientists, not just social scientists, but a good set group of people. And we think about having an ethicist as part of the team who can develop a strong, ethical, independent ethical report, which we have always done in our work, and evaluation. Now, if you're interested in our work, as Mark said, there's a bunch of summaries of our work in many fora that please do go and have a look. It's really written for sort of non-experts in either domain or machine learning. And I encourage you to take a look and see how you see that we are using those 6 principles. But today's workshop is really about what we think of as the major research challenges at the moment that are exercising us. And those are about transparency and fairness, which is 2 components we're going to talk about today, which is the challenge of ensuring that there is no racial bias in what we're doing, and in fact that anything we do reduces racial bias of decision making as far as we can. And the second is whether we are meeting our ethical obligation to explain what this tool is doing. So that's sometimes called explainable AI. The third thing we're going to talk about is how do we achieve our ethical obligation to evaluate. So I'll now turn it over to Diana, who'll speak about the challenges of fairness and racial disparities.
Thank you, Rhema. Thanks for that introduction. So as Rhema mentioned, I'm Diana, and I work as a senior research fellow at the Center for Social Data Analytics at AUT in New Zealand. And what I'm going to talk about today is basically a challenge of algorithmic bias and fairness in the context of the Allegheny Family Screening Tool that is a tool, as Rhema has mentioned, that has been deployed in Pennsylvania in the Allegheny County. So like as a general introduction of the tool, along the lines that Rhema explained, the kinds of machine learning solutions that we help agencies to construct and deploy, the AFST, Allegheny Family Screening Tool, is a tool that helps the call screening staff in Allegheny County to perform the process of screening referrals for further investigation, and basically provides these decision makers with a score between 1 and 20, indicating the risk of a child to be placed in foster care after 2 years of the upcoming referral. And the tool is accompanied by some protocols that the agency also has worked on in terms of what a high risk or low risk referral means. So this is how the tool actually looks like, and is basically providing this staff with a score indicating that risk, and is being deployed since August 2016. So it's been in use for quite a period of time. So the challenge I want to talk about today is the challenge of fairness, which has been extensively studied in the computer science community in the last few years. And the whole concern of fairness is basically how can we make sure that an algorithmic tool that we are deploying for the sake of supporting decision-making, especially decision-making affecting people, is not biased against some subgroup of population, for example, in the case of the AFST, African-American families. And this concern, basically, there is a very good example of this concern in the context of risk assessment tools. So the problem of ProPublica that I mentioned here as an example, it was found to, it was a risk assessment tool that helped decision makers to determine where an individual actually deserve like the chance of being granted parole. So what the tool was doing was to actually predict the risk of recidivism of an individual in a period of time in the future. And the tool was actually found to not satisfy some of the definitions of fairness, and especially in the sense of systematically risky scoring as higher scores to African-American defendants. So this is one of the basic examples of algorithmic bias, which the whole concern of algorithmic bias is where those machine learning tools that we are deploying for decision making are actually systematically biased against some subgroups. And this can come from the fact that, for example, we are feeding the tool with data which is already biased against some subgroup of the population. And the whole concern is that potentially this tool will help to perpetuate those bias, because there is bias embedded in the tool, and therefore there will be bias into the decision-making process later on. So fairness in machine learning is a whole area of research. As I mentioned, it's been extensively studied in the last, I would say, 5 years. And the whole concern of fairness of machine learning is to study the problem of how can we make machine learning based tools fair in the sense of, for example, predicting risk of experiencing an outcome without distinguishing across different subgroups of the population, for example, based on race. So in the research in fairness in machine learning, there have been several definitions of what a fair machine learning tool is, and I'm going to mention some of them which have been the more studied in the existing literature. So the first definition of fairness in machine learning is the concept of statistical parity. So suppose we have, similar to the AFST, we have a risk score given by a machine learning tool which goes from 1 to 20. And then we define a threshold on that risk score that will allow us to provide some interventions to say, for example, the higher risk group. So what the concept of statistical parity is telling us is that for a tool to be fair for those subgroups of population, we need to make sure that the probability of the score being higher than that threshold that we are using to determine an intervention should not depend on what racial subgroup, for example, an individual belongs to. The second concept of fairness in machine learning, the second definition which has been studied in the existing literature, is the concept of error rate balance in the sense of equal true positive rates. So again, we have our risk score from 1 to 20. We have a risk threshold that help us to define interventions for the high risk group, and the concept of error rate balance in the sense of the TPR tell us that in order for this tool to be fair for different subgroups of the population, the probability of the score being higher than that defined threshold, given that these individuals actually experience the outcome that we are interested in, should not depend on which subgroup an individual belongs to. The concept of error rate balance can also be studied in terms of the false positive rate, which is sort of the opposite from the previous definition, in the sense that, so this concept tells us for a machine learning tool to be fair for different subgroups of the population, the probability of the score being higher than that threshold for intervention, given that the individual doesn't at the end experience that outcome, should not depend on the for example, racial subgroups that the individual belongs to. And the last concept that has been extensively studied is the concept of subgroup calibration or predictive parity, which basically tells us that the accuracy of the individuals that we classify in that high risk group, given that risk threshold, for those individuals that actually experience the outcome of interest, for example, placement or recidivism in the example of ProPublica, again, should not be dependent on the, for example, racial subgroup that that individual belongs to. So given those definitions, the computer science community also has studied ways to try to guarantee that those properties of fairness in machine learning are actually satisfied. So there have been methods proposed in the 3 stages of the development of machine learning tools. How, for example, do we preprocess the data that may be already biased to some extent in order to make it less biased? How do we, in the processing stage, how do we adapt machine learning techniques to actually try to encourage some of those definitions of fairness? Or how do we post-process the results given by a machine learning tool, for example, by using different thresholding mechanisms for different subgroups that have different rates of those outcomes? So given those definitions and those existing studies in the context of fairness in machine learning, of course, while we experimented and deployed the AFST, we explored some of those definitions in order to determine how the concept of fairness played into the AFST. So the first thing we did was to explore, of course, the existing biases in the underlying data that we used to build the model supporting that tool. And one of the things we found, which was not unexpected because this is quite well known in the child welfare domain, especially in Allegheny County, was that there was an existing bias in terms of different rates of the outcome of the placement rate for the largest subgroups of the population in Allegheny County, so Black and white. So we can see here that the Black subgroup actually faces a higher rate of placement compared to a white group. And that may create, of course, challenges in terms of the model we employ. The second thing that we explored was the concept of error rate balance. So what we wanted to do here was to explore whether the tool had substantially different error rate balances, especially for the Black and white subgroups. And we explored like a couple of model options that we had at the time. Option based on the logistic regression method and an option based on random forest, which is another machine learning technique. And what we found is that actually those error rate balance, especially for the Black and white subgroup, didn't differ to like a extent of concerning too much around disparities in this regard. The final concept that we explored for the AFST was the concept of subgroup calibration. So how accurate is the tool into placing on the high risk group, the group number 20, children that actually later on experience the outcome of placement out of home. Again, we explore to the left the logistic regression version of the model and to the right the random forest version of the model. And what we found in both cases, and what's quite surprising at the time, was that the tool seemed to be better calibrated for identifying well the children from the Black subgroup that actually later on face the outcome that we aim to predict. But apart from those definitions, which have been quite useful in the area and in terms of studying the properties of algorithmic fairness, we also, because the tool has been implemented for 4 years now and has been actually used for the process of screening referrals, we wanted to look at what we call fairness in practice. So where the introduction of the tool has actually changed how the screening rates work in terms of Black and non-Black subgroups. So here in this plot, what we compare on the red line, you can see the trend on the screening rates for Black and non-Black subgroup pre-implementation. So before the AFST started being used, and post-implementation, so after the AFST was introduced in 2016. So we found two interesting things in looking at fairness in practice. One of the things that we found is that before the introduction of the AFST, as we can see in the red lines for both the Black and non-Black subgroups, the screening rate was systematically higher for Black. So you can see a higher line for Black compared to non-Black here, regardless of race. So it was quite flat in both cases, but higher, systematically higher for Black. But after the introduction of the AFST, we can see that the screening rate for both Black and non-Black subgroup actually aligns with the AFST score, and the trend has actually changed not only for one subgroup of the population, but actually for both Black and non-Black, which is quite an interesting result. So what have we learned after exploring those sort of theoretical definitions of fairness, but also exploring fairness in practice? So one of the things that we have learned is that algorithmic fairness is, rather than a technical only problem, is a problem of looking at the process that actually involves decision-making, combining humans and algorithms. So if we want to achieve algorithmic fairness, my personal opinion is that we actually need to look at that from a systemic perspective that actually involves those two pieces to a decision-making process, humans and algorithms. So as I mentioned, algorithmic fairness should be addressed from this system's perspective, and some more people have also identified this underlying need in order to actually make sure that we deploy machine learning tools that satisfy those characteristics of fairness that we want to satisfy. And we need to consider more properties beyond the current fairness definition. So humans plus algorithms. And also part of our current work is also figuring out how can we adapt the learning process to consider other sort of outcomes which are actually of concern for society. So we also consider that rather than considering the definitions of fairness in the context of the outcome that the model has been trained for, we also need to look beyond that and consider more universal outcomes. So in the case of child welfare, maltreatment related deaths, for example, that we actually want to encourage fairness for in these subgroups. So thank you. I hope this gave you like a few tips in the area of fairness in machine learning. Thank you, Rhema.
Thanks, Diana. So that was a valuable insight into technical and the challenges of converting that technical into something that the communities of color can actually feel confident, more confident in the algorithm because it has these properties. So that's where we're finding a disjunction between the technical solutions and the solutions that communities want. And I think we're going to find the same thing with the next speaker, who's Gayani Tenakun, who's going to now move to how do we explain how models are working to community and individuals.
Thank you, Rhema, for the introduction. So I'm Gayani. I work as a research fellow in data science at the Institute for Social Science Research, and I have been working with Rhema for like 8 months now. So today I'm going to share my experience in using explanation methods in predicting educational outcomes of critically ill children. So first, let me give you a simple idea about the terminologies that I'm going to use today. So I'm going to talk about 2 types of explanations. The local explanations, which tries to explain you why model makes certain prediction for a single case, and whereas the global explainability tries to give you a summarized overview of the model to see whether this model achieved its intended purpose. So let me walk you through a simple example to clarify the importance of local explainability. Let's assume that doctor wants to predict the risk of a patient developing a heart disease in future. So in a normal setting, the doctor has to go through the current health information and the health history of this patient and use his knowledge and past experience and come up with some rules to come up with the risk score for this patient. However, when the amount of data grows and he has to consider different piece of informations, the human have this limitation of analyzing all of these information effectively, and it can be really time consuming and expensive process. This is where the machine learning can be helpful because the machines have the capacity to analyze large amount of information quickly and identify underlying relationships and patterns within the data. So if you are using a machine learning model to get the predictions, it will give you some score and it will tell you about its accuracy of the model. However, there's something missing here because if the doctor has done it by himself, he used some reasoning process and he know the reason behind this score. But with this machine learning models, often they act as black boxes. That means we don't see what is happening inside this decision making process. So it arises a lot of questions related to the reliability, fairness of this decision. So instead of just giving an score, what these explanations trying to tell is like, what are the factors that affect this decision? So for example, what are the features that increase this risk of this patient developing a heart disease? Or on the other hand, what are the features that decrease this probability? So when you get some explanation about the decision alongside with this score, then it does make more sense, and doctor can think about this more in deep and apply his knowledge and experience and make the decision in a stronger way without blindly following the model. So when it comes to global explainability, because the local explainability, it's targeting a different audience, but if you are consider about a policymaker who wants to go to a community and explain about this model in a summarized way, then this global explainability comes in to help, because it can tell you about a summarized view of the how model work and tell about like information about like what are the important features used for these predictions and how they contribute to the prediction as an average, and is these impacts are like equally distributed within different groups in the population. So that sort of summarized view can be given by the global explainability. So as we can see that depending on the audience you are addressing, you need to come up with different customizable explanations. So next I will show, I will going to talk about quickly about the project we were working on and where we try these explanation methods. So in this project, our objective was to use the data that is available at the point of pediatric intensive care unit discharge of children to predict that child's risk of perform poorly at school. So we developed a predictive risk model for that, and we explore with existing explanation methods to understand whether those predictions given by the model make sense. So as in normal data science process, we go through these 3 phases. In first phase, we do some data pre-processing and we extract features from the data available. So in our case, we have these PICU admissions. We extract features from the related to the patient stay in the ICUs, and then our outcome was extracted from their NAPLAN test results. And then we developed a predictive risk model. Normally we divide the data set into a train set and test set, where we build the model using the train set, and then the test set is used to measure the accuracy of the model. So in a normal setting, when evaluating, we use some standard measures to evaluate the model based on its sensitivity and precision. And so in this study, in addition to using these standard measures, we use some of the state-of-the-art explanation methods to understand the decisions. So to quickly give you some idea about the performance of this model, so this figure shows the precision of these predictions with regards to each of the risk scores. So as you can see, when you go from low risk score to high risk score, this positive predictive value increases. What does that mean is like out of the children who are assigned to risk score 1, which is the lowest risk score, only like 2% of them actually ended up not achieving the national minimum standards of the test, whereas in the risk group 20, which is the highest risk group, like 84% of these children ended up not achieving. So this shows the model's ability to stratify children according to their risk. So to get more sense about these individual predictions, we tried with existing local explanation methods. So this is like 2 examples explaining a high-risk case and a low-risk case. So the left-hand side shows the probability predicted by the model. In this case, it is like 0.98, very high risk prediction. And in this middle part, it shows the features that contributed to this prediction, features, and the orange color highlighted ones are the features that contributed to increase the prediction, and blue color ones are the features that contributed to decrease the prediction. And by analyzing this, we can do some reasoning and see why this model predict high score for this child. However, you may find it may be difficult to understand, like especially for a layperson without much understanding about these machine learning methods. These existing methods are not very intuitive and give user-friendly explanations. Next, we see how we can look into the model, how we can explain the models in a global level. So this is an example of like we were trying to integrate all the individual explanations and try to find the feature importance. So in the y-axis, it shows all the features used for this prediction and their contribution to each individual instance. So this is using two different methods. As you can see, these two methods give somewhat different explanations. So in the literature, it is really unclear how to evaluate this existing method and how to select a best working method for the given scenario. So those are some of the learnings from this work I took. Like the model explanations are promising because it gives you the opportunity to open these black boxes and see what is happening. But there are some open research questions that needs to be addressed before safely applying these things in a real world system. So I think I see questions in the areas like usability, methodology, and evaluation. So these explanation methods really should consider about the context or the domain they are going to deploy, because depending on the context, the explanations required by the end user can be different. So when you design and develop these explanation methods, first thing is you should first understand what is the actual requirement, and then the explanation needs to be more human friendly and also should be able to customize according to the audience. And there are some concerns about the methodology related to faithfulness and robustness of these methods, because the explanation should actually reveal the actual behavior of the model. If it hides or give a misinterpretation about the actual model, it can bring a lot of harm than the good. So we need to consider about these factors when developing explanation methods. Finally, it is not clear what and how to evaluate these measures. When you think about how to do it, we need to consider both of these factors, the usability factors and methodology related issues, and see what evaluation need to be done to address these issues. And going forward, like we were also planning to see like to understand what are the user requirements, especially in domains like human services. First, we need to get those requirements ready, and then we need to see whether the existing methods meet these criteria. If not, we need to go for improvements with existing methods. So this is actually like an emerging field of research, and we see people, the community identify these existing methods, and they're trying to come up with solutions so that we can be hopeful and looking forward to actually using these explanations in real world systems. So which will improve the user trust and make these tools very useful. So I'm going to stop here, and I think Ola will talk more about how they are going to use this human-friendly explanation in an interactive way. So if you have any questions, please put in the Q&A section.
Thank you, Gayani. Thank you. That was great. So I think we can see that we are struggling with some of the explanation methods. And one of the things I think the challenge for us all is that these are machine learning tools are not causal. And yet when humans want explanations, they want some sort of causal connection. The irony is that we know a lot of clinical decision-making and social worker decision-making are based on heuristics, which themselves are not super causal. Yet when a human tells you a heuristic rule, you think they've explained something. When a machine tells you a heuristic rule, you think that's not a satisfactory explanation. So there's a lot of work we have to do to understand what a satisfactory explanation is from a machine versus a human, and why we're seeing very different standards. And I think Ola's work is trying to help us understand that by putting some of these tools in the field to understand much more carefully. Thanks, Ola.
Thanks, Rhema. So hello, everyone. My name is Ola. I am a PhD student at MIT, and I'll be talking a little bit today about the specific goal of explaining machine learning predictions to child welfare screeners in that specific domain and the challenges that are coming up with that. So again, I'm sort of going to quickly go over some of these motivations again of why do we want child welfare screeners or other domain experts in a similar position be able to understand the machine learning explanations. And there's many reasons, so we'll just go over some of the important ones. Again, validating the model is very important. Even if we know that a model did well in a test set, that may still be relying on correlations that may not exist at all in the real world. And then there's this issue of accountability and fairness. And this is especially important in high stakes decision-making like child welfare screening. Even if correlations maybe exist, they may not be fair. It may be relying on features that are not actionable. So for example, race is something that we would not consider actionable. A person can't change that. So we don't want to be making important decisions based on things like that. And of course, people have the right to know why decisions that affect them were made. So usually when humans are making important decisions that affect you, you can ask why did this happen? What can I do to improve? How can I prevent this from happening again in the future? Or how can I have a more desirable result? But with a machine learning algorithm, all we're getting is a prediction. There's nothing behind that. So we can't give this kind of explanation. And then another big focus here is on making models more useful. So I like to think of a machine learning model as, imagine you're in a boardroom, you're trying to make a decision with a group of people, and you have one person in the room who just gives their opinion on everything and then tells you nothing else. Maybe you've met someone like this in the past. It's not helpful. You can't have a conversation with them. You can't figure out why, how does your information mesh with theirs? And you're left probably feeling rather frustrated. And this is exactly what a machine learning prediction is doing if it doesn't have an explanation. And this is especially important in the child welfare case because the humans know a lot that the machine learning model doesn't. They have information about the referral at hand. They have personal experiences. They have their own past experiences. And if they disagree with the model, it may be because the model has noticed something that the human doesn't notice, or it may be that the humans know something the model doesn't. And the humans may try to explain these discrepancies. They may try to justify them. But if they end up coming up with the wrong justification, then it could cause them to misuse the model and either trust it or mistrust it when they shouldn't. So there's a lot of challenges. First of all, there's a lot of work on explaining machine learning models. This has been a very popular field lately, but we're still seeing a lot of shortcomings. So the biggest one is that over and over again, we're seeing literature that focuses on a technical audience. And specifically when I say technical here, I mean machine learning experts and data scientists. And these kind of explanations are helpful. It's useful for someone developing a model to be able to look into these correlations, debug it, improve their model, but it's not enough. And what we're seeing is, so either they're focusing on this machine learning experts, or they're focusing on people who maybe aren't machine learning experts, but still work heavily with data, or maybe the literature does try to make an explanation for somebody who isn't technical, but what happens is they make the explanation first, and then they come to the end user and they say, look at this, isn't this nice? Now use it. And not to call out the other literature too much, but there is a little bit of a lack of this sort of collaboration between the end user and the machine learning scientist who's trying to explain the models. And so another problem, and that partially comes from this, is that a lot of these explanations, they may be quite thorough, they may be quite accurate, but they take a lot of time to analyze and understand. They have these very complex visualizations that show you a lot of numbers, and it's hard to make sense of this. And it's especially hard to make sense of this in a very short period of time. I'll talk about that in a minute as well. And then exactly like Annie was saying, a lot of these interpretability methods are not evaluated enough. So we already heard a little bit about the lack of evaluation for accuracy, how there might be some evidence sometimes that the machine learning explanation is not really explaining the model well. But there's also another side of that, of evaluating for usefulness. So even if you do have an explanation that you know is accurate, you know it's perfectly describing the model, again, it might be too complicated, or it may be explaining in ways that's confusing. So I want to sort of lay down some of the requirements we have here specifically for the child welfare example. First is, again, this issue of time. The child welfare decision makers are making these decisions in maybe 5 to 10 minutes per case, but a lot of this time needs to be spent discussing, understanding the case, looking into the details. So really, if we're trying to explain the machine learning model, it needs to happen in under a minute, or it's just not going to be helpful. Of course, it needs to be understandable to people with no prior machine learning experience. We're not assuming any kind of machine learning or data science experience here. And we want to integrate with the existing workflow. So our goal is not for something that they'll pull up and go, oh yes, that's the explanation on the side. We want it to be something that they can actually interact with and that explains the machine learning model using language and concepts that the screeners understand. So for example, what we see is that screeners will bring up factors that they call risk factors or protective factors. These are things that we know are increasing the risk. These are things that we know are decreasing the risk. And if we can kind of mirror that with our explanation, because the machine learning is also using its features, that may be helpful. But again, it's something that needs to be evaluated. And then, of course, we want to avoid misleading or causing bad decision making. And again, this machine learning model, it's not causal. We don't want to imply that it is causal through our explanations. So now I have a short video here that quickly introduces the tool that we created for testing purposes. And then I'll talk a little bit more after about the steps we've taken to test and then modify these tools.
Well, you can investigate risk score predictions. You may want to know why the model made its decision. The details page provides information about the child in focus and how much each feature contributed to their predicted risk score. Factors causing the risk score to increase have red bars, and factors causing the risk score to decrease have blue bars. The larger the bar, the larger the contribution. Some features may not contribute at all to the risk score for the child. These have no bar. You can switch to a side-by-side view using this button. Another question you may have is, how would the model prediction change under different circumstances? The sandbox page allows you to see how the model prediction would change when particular circumstances differ. In the top section, you can choose up to 4 features to change. The updated prediction under these changes will appear here. In the bottom section, you can see how the model prediction would change if each feature had the opposite value. Finally, you may ask how the model makes its predictions in general, and how it predicted in past cases. The Global Feature Importances page shows you how important each feature is to the risk score prediction model overall. The Feature Distributions page shows you what the features for each risk score generally look like. Now you will be asked to make a series of decisions with help from the risk score model, using Sybil to help you understand the model's predictions.
Don't worry, I'm not actually going to ask anyone to make decisions right now. That's from a user study. So that was sort of a very quick introduction to our tool, and you may have noticed that that was a lot of information, definitely not parsable in 1 minute, but our goal here was to start seeing real screeners interact with these different explanations and see how they used it, what they found helpful, and what they didn't. In this particular case, what we saw is that first screen, the detail screen, was the most popular. It's sort of a simple and intuitive way of explaining how each feature contributed. But as we saw earlier, sometimes these feature contribution methods aren't as rigorously evaluated as possible, so it's also something to consider. So our future improvements main sort of focuses after our first round of user studies based on that tool. First is finding this line between a strictly accurate and a useful explanation. So when I say a strictly accurate explanation, I mean one that describes exactly what a machine learning model is doing under the hood. And there are places where this could actually cause confusion. So one example is if you have two very correlated features, a machine learning model might only use one of those very correlated features. And then the explanation, if it's entirely accurate, will reflect that, which means that a user might see that a feature that they think should be used isn't being used. And rather than this being, it kind of makes sense, it may not necessarily affect performance, but someone who's not familiar with machine learning might not understand what's going on. And a big one, again, is just avoiding falsely suggesting that we're explaining the case and not rather than the model. So every explanation we have here, it's explaining the model's prediction and why it's predicting that. We're not making any suggestions about what should be done. So for example, if we're saying that some benefit may decrease the risk score, that doesn't mean that that benefit is something that should be offered to the child necessarily. And there are places where the model might appear to make decisions in a strange way. And that doesn't mean that we're implying that some feature is actually a risk score or a risk factor when they thought it was protective. It just means that there's something in the data, there's some pattern that exists. And of course, like I said, we need to reduce information load a lot. So on the original details page that you saw in that video, for example, we showed all several hundred features. So in the new version, we'll be showing only the most important features with options to see more later, as well as combining some features in order to present them in a way that sounds more like the way a human would communicate. So rather than using true false, so child has a sibling, true, child has a sibling, false, we're now presenting things like child has a sibling, child does not have a sibling. So again, key takeaways here. When you have a case of high stakes machine learning decisions, there is a lot of benefit to explanation. And without explanations, we may be missing some very important things. And the choice of machine learning explanation is very context dependent. So the technical expertise of your audience is important. The way that your audience interacts with data and the way that they do their job is important. And a lot of existing literature has not necessarily delved deep enough into these cases when you have non-technical domains.
Okay, thank you, Ola. So next we will, for want of speed, we will move straight on to Chris. Thank you, Chris.
Thanks so much, Rhema. I'm Chris Mills. I'm a PhD candidate in economics at Princeton University, studying decision-making in child welfare. And so I'm going to talk a little bit about why we want to evaluate some of the tools that we're developing, and specifically through the lens of a project that we're rolling out in Colorado. And this project is joint work with Marie-Pascale Grimond, who's at Harvard Kennedy. So why do we want to evaluate risk assessment tools? So I'll start out with a thought experiment. Imagine you're a company and you needed to hire employees. You'd probably put a lot of work into who you decide to hire for your company in terms of vetting them, evaluating them, or just imagine what your own organization does in terms of employees. So oftentimes groups spend a lot of effort trying to get the best employees, but we don't really evaluate a lot of the algorithms that we just take out of the box. Here's another comparison when we think about algorithms. Thinking about algorithms as medicine. So there's a very comprehensive clinical trial process in the United States. These 4 phases that have to go through the FDA. And so we can think about evaluating algorithms, particularly as stages 3 and 4. So in these early stages where you have to figure out if the dosage is safe, if these medicines are going to work, and in later stages, checking up on whether the medicine is actually effective for patients. Not only, does it have side effects, does it work as intended? Second, there are many ways to implement a tool, right? So there are many different algorithms that can be implemented in practice, and we would like to know which one works the best. And so evaluation can help us know which tools do the job best. And then finally, evaluation and looking at data can help us to understand mechanisms, to understand why did a tool work the way it did. And so we take away insights that we can use in other contexts. So why do we care about evaluation? Well, in particular, the way that an algorithm works in theory might not be the same way that it works in practice. The same thing is true perhaps with medicine, right? In the lab or on animals or in a petri dish versus with people. And so we have a fairly comprehensive literature on how algorithms can improve decision-making in a lot of contexts. However, in many contexts, including child welfare, algorithms often are used in combination with people because we want people to have some oversight over decision-making. However, this can have unintended consequences. And so we have a variety of papers from especially the crime literature on how sometimes when decision tools are combined with human decision makers, humans might selectively decide which people to use the algorithm for and then to ignore it for other demographic groups. So there's a paper, the Stevens and Doliak paper that's featured in this Washington Post article mentions how judges would selectively ignore age or were very lenient for young defendants when making decisions to sentence. But age was one of the top factors in the algorithm for predicting criminality. The same thing is true with racial disparities in other crime settings. And so when we evaluate, we want to see, are there any unintended consequences of mixing algorithmic decisions with people's decisions? And so in light of this general lack of evidence, we think that child welfare is a domain in which algorithms could really improve decision-making, even in combination with people. And we'd like to know what's the effect that these decisions tools have in terms of allocating investigations to families. So as Rhema mentioned in the opening presentation, unfortunately, child maltreatment is quite common in the United States and worldwide. So approximately 37% of kids receive some kind of child protective services investigation, and many more are referred. However, in any given year, fewer than half of referrals get investigated, and screeners are often very constrained in the time that they have. So that's why this slide says the economics of child maltreatment. We think about allocating a scarce resource, in this case investigations, across families to make sure that the families who need investigations the most get them, and the families that don't need an investigation might be traumatized by one, don't get one. And so this is a setting in which we think there are potential positive gains from predictive risk modeling. So this is a project where we're using a risk score and an explanation that Ola has been developing to study decision-making and child outcomes in a county in Colorado. And to evaluate this tool, we're going to be randomizing at the family level. We'll be using various data sources from the public systems that are available to us. And this is just getting underway, so we anticipate our results to be out next year, but I'll walk through how we're planning to evaluate this trial and the work that we've done so far. So as we've talked about in some of the prior presentations, this decision aid tool assigns a score to each referral that's coming in on the predicted, that corresponds to a likelihood that a child will be removed from their home within 2 years. We notice in this case, it's nonlinear, and so it's important to have this visual aid given to workers, but this is our primary intervention. And one thing I just want to note when we think about evaluation is there's a lot of behind the scenes work that goes into evaluation. It's very easy to sabotage an RCT and not give people the proper training or information such that they say, oh, this intervention had no effect, and therefore it does nothing. And so responsible implementation is a really important component of ethical social science in terms of giving workers the proper training with the tool, being able to interpret what the scores of the tool mean. In this case, these scores respond to certain percentages of removal from the training data. And we saw this also with a prior intervention in another county in Colorado, where there was a score-only intervention. In that case, buy-in from the agency was really critical. In this particular study, one thing that we're doing to go beyond that prior study is we include this explanation component in our study that Ola has been developing. And so in many cases, not only will workers see a risk score, they'll also receive an explanation for why that score is high or low. For instance, the father or the mother has a certain history of child abuse, neglect. Just a quick note on randomization and evaluation, right? We think, okay, thought experiment, right? Let's say you were implementing this. How would we decide what the effect of the tool on decision-making is? Well, one thing we could say is, well, we could look at decision-making or child outcomes in this county before and after the tool was introduced. The problem is there could be a lot of other things that are changing over time too. For instance, we could be in the midst of a global pandemic or schools reopen. You could say, well, maybe we can compare this county or this decision-making team to some other county or some other team. But the challenge with that is, there are differences across teams or across counties. Maybe children and decision makers are different in these two different places. And so when we think about a potential outcomes framework, the fundamental challenge with causal inference is we can't observe people in both states of the world, in both the state where they receive the treatment, in this case the score, and in the case where they don't receive the score. And so we want to take a large group of people who we see the score for and a large group of people who we don't see the score for, who are comparable in terms of their background and all these other characteristics, and then compare the average, and we can back out a treatment effect. And so in this case, one of the more straightforward ways to do that is to randomize within decision-making teams at the mother level. And so that's how evaluation is working in this context, although we're using some other designs. And so a lot of evaluation is using clever data work and causal inference strategies to say something about the study. And so here's a quick preliminary study timeline that we had put together. Just noting that within these decision-making teams, we have treatment and control groups, where for part of it, we're seeing just the score only. For part, we're seeing a score plus an explanation. I think one of the other key takeaways that we had for evaluation was that we realized that just seeing this tool in general could be an intervention that caused workers to check the history more. And so when we think about translational research that is really at the cutting edge of policy and working with organizations, I've personally learned a lot. And you learn a lot when you're really, when the rubber hits the road, when you're working with these agencies and we say, oh, wow, maybe we should make one of our groups a peer control group for a certain period, just so we make sure we're not contaminating the within team control groups with a history intervention. So that's just an example of some of the nuances that come in with evaluation. So to wrap up, in terms of reflections on evaluation, I think the key comparison or the key analogy to stress is just thinking about algorithms as medication. So effectiveness in the lab may not be effectiveness in practice, especially when we're interacting with people. And so where do we go from here? Well, maybe we can talk a little bit about this during the Q&A, but I think one of the key parts, especially with public agencies, incentivizing evaluation, because there are just several barriers to doing so. Interdisciplinary collaboration. So the work I've been able to do with Rhema and the team has been really beneficial in terms of seeing how collaboration between researchers and policymakers and across different academic fields, computer science, economics, it helps to figure out what questions need to be evaluated and how do we actually implement what we want to implement the right way. And then finally, registries and transparency. And so the American Economic Association has started trying to do this, and this has its own set of challenges, but being transparent about the studies that are out there and being done, so more researchers can be open about what they're working on. And so, yeah, happy to take more questions on this, but thank you so much.
Thanks a lot, Chris. So we've got a few questions here. We've got one from Jack. If one was to develop predictive risk models in which race data was absent, to what extent could this be used to determine racism present in decision making? And I think there's a more general question there about whether we can use these algorithms to uncover racial bias in existing human decision making. And Diana, do you want to maybe make a comment on that?
Yeah, sure. Yeah. So yeah, that's actually a really good question, because those fairness definitions that I presented on my slide rely on the assumption that we can actually observe that race factor in order to evaluate those definitions. So I think there are like two ways in which we could approach that problem. So the first way is basically from a purely technical data perspective. So we could try to find other factors that could potentially proxies to race. So for example, the living neighborhoods of people, or other factors like socioeconomic categories, etc., that could actually have like a high correlation with those individuals belonging to a particular racial subgroup. So as like a purely technical approach that we could take. The other approach is more like from a process point of view. So we could, and in alignment with the evaluation aspect that Chris was explaining, we could actually try to use part of the evaluation before the actual tool is deployed for the actual decision-making process, in order to determine whether the tool is actually biased against some of those subgroups of population. So it could be like an inherent part of the evaluation process before we actually deploy the tool, or we could actually look at other parts of the process and what kinds of differences are we detecting on those other parts of the process. So for example, in the context of child maltreatment, we could go beyond the process of screening referrals and look at, I don't know, differences in the kind of services that we are providing to different families, or differences in other kinds of outcomes than the outcomes that the model has been trained for. So one of the solutions, as I mentioned, is purely technical and purely from the data perspective, and the other one involves more the process in order to determine whether we are treating differently different subgroups of the population, and we have a potential for racism embedded into those tools.
Thanks, Diana. There's a question from Oliver, who says you guys were brilliant, but he also asks, this could be an OLAC question, have you engaged with end user health professionals and so on to develop the language and design? So maybe talk a little bit about what your end user engagement looks like.
That's a really great question. So we have engaged multiple times with the child welfare screeners. So before beginning any work on explainability, we went and watched them make their decisions. We talked to them and asked them what kinds of things they would want to see, sort of get a sense of what the shortcomings were with the existing approach and where we could go from there. We showed them mock-ups at multiple times in the development process of the design we had, and got feedback there. So that's where we learned things like the language they use of risk and protective models. We saw potential difficulties with misinterpreting some explanations. So for example, with the sandbox, when we say, you know, if you change this feature, this is the new risk score, we were alerted to potentially that leading to causing misleading information. We also watched the screeners make decisions using the machine learning model alone. I think that was especially enlightening because this sort of revealed exactly what kinds of added information they wanted to see. And it also just motivated. We heard, without any bringing up explanation at all, we heard them ask why a lot. Why is model prediction like this in that conversation as well. And then the final type of interaction we have is user studies. So have them use the tool to make decisions, see what comments they make, see how their decision-making changes, and so on.
Thanks, Ola. There's a question come in. I might pass this to you, Gayani, asking to what extent do you think we should sacrifice accuracy to enhance explainability if some of those features are really not giving you a lot of face validity? What is our ethical? What do you think the ethical position is on accuracy versus explainability?
As I read and understood with many works in this area, like most of the previous work actually does this, sacrificing this accuracy for the interpretability, but it really depends on how much we sacrifice. Like if a complex model give you a high accuracy and the difference is very large, we can't afford that actually, because if we have the capability to do that, why don't we do that? That is where this explainability need to stood up and fix these issues. On the other hand, like I have this opinion about this interpretability. Sometimes we say that these simple models are interpretable, but it's really questionable whether these coefficients given by these simple models, they can be interpretable for a like data scientist or developer, but are they actually interpretable for the end user? So that question is also there. So
thanks, Gani.
yeah.
Yes, I can reiterate Gani's final, because we certainly experimented with some of the SLIM models and the risk SLIM and took it to frontline workers. The SLIM approach is to really strip your features really down a lot, but they confuse the hell out of the frontline workers. So that's a very good insight. So I'll keep working on the Q&A. So one of the questions we have from one of the people in the back room, so you won't see it in the chat, is about social license, about how we get community buy-in. Because if you remember, one of the features we were emphasizing was communities, and we didn't talk about it today, but we do have a whole research program on using participatory design methods to extract community values and what communities want to see. And we've got a few papers on that. In particular, we have a paper from last year's CHI conference in it. If you want to see it, it's Anna Brown and myself and Alex Schulder-Cheever. The results from that suggested that really people trusted algorithms in a system to the extent they trusted the system. They couldn't specifically separate out an algorithm from what they thought of as the overall system trust. So some people who have been working a lot on just looking at algorithms sort of separated and in an island of trust, that we're really barking up a wrong tree. Communities wrap algorithms up into their attitude to the whole system. So when we work with communities, and when I go and present on our work, to which I do very often to communities of color and communities who might be considered to have low trust in the system, that they're really trying to tell us that their concerns are about system level issues, not about algorithm level issues. So the second, so we have a question here from Paul. Thanks, Paul. Doesn't the model, so someone's asking, would the NAPLAN's prediction of poor outcomes, isn't it highly correlated to health, to socioeconomic conditions, which are correlated to health? So aren't you picking up socioeconomic status when you're picking up health, I think is the question. Do you want to answer that, Gani? Or?
Yeah, it's an interesting question that, so in our study so far, we only consider this hospital like health-related factors of these students, how they, and the model picks up the relationships between the educational outcome and their health factors. So yeah, there can be like correlations with those socioeconomic factors. But for the moment, the model only consider these health factors. So it can be correlated, the health factors can be correlated with the socioeconomic factors, but not sure whether they are picking up with when you use only the data related to health. So it's always like have like room for using those other sort of informations for these models, and we can get more insights onto this. You're on mute, Rhema.
I've got a question for Chris. What do you think is preventing us from having more evaluations of algorithms? I mean, it seems like every other person is talking about algorithms, and yet we're not seeing even any experimental, let alone quasi-experimental evaluations.
Yeah, that's a good question. I think from my conversations with folks in child welfare, at least in the public sector, I think there are at least 3 obstacles. One in general would be, at least in the United States, a lack of funding for these organizations. I'm not sure how it compares in Australia, but just, so many people in these organizations just have such limited bandwidth to even think about evaluation to begin with when they're putting out fires. I think another similar constraint to consider is just that I think evaluations are in many cases long-term investments. But specifically within a child welfare context, in many public agencies, there's high turnover. There just might not be the personal or departmental incentives there to invest a lot of time and effort in a particular evaluation, especially if it's something that doesn't work, right? People get very committed to particular kinds of tools or are very opposed to particular kinds of tools. And it's very difficult to change people's minds, even when there is evidence, just because this is, and rightly so, like an emotional area. But in many high stakes decision-making areas, these decisions, there are particular philosophies that are difficult to override with data. And then I think also an obstacle that we are quickly overcoming is, in many cases, we need lots of integrated data to understand the impact, fairness, efficacy of these tools. So as I was mentioning at the end, in the US at least, we're finally beginning to get through that. There are collaborative partnerships between universities and agencies in California, and obviously what we're doing now in Colorado and places like Wisconsin. So I think those are 3 or 4 constraints to the problem of evaluation. I think finding ways for governments and for for university systems to try to reduce those constraints, I think is the way forward in leading to more and more impactful evaluation.
Okay, thank you. I think we might be coming to the end of our session. I'll leave it to Mark to wrap up, but just to say thank you to all our panelists and thank you for the audience for participating. I hope you got a sense of what the complications of running a live project like this is. We meet every week. It's a lot of work, but I think it really is worth it because we are seeing in live what the issues are for folks, and we are able to feed back to the more theoretical research community what applied people like me need from the research to help actually bridge the gap between research and impact. And that's really what CSDA, our Center for Social Data Analytics, which now is both in University of Queensland and Auckland University of Technology, is really committed to. It's research that has an impact and research in data science that has an impact, and to build that pipeline between impactful frontline engagement and what we have to feed back to researchers about where the research frontier needs to be, and pick out what's at the research frontier and see how quickly we can support researchers to bring those research into use. Because I think what we are all seeing is the research frontier keeps moving, and a lot of practice and things that really matter to us, which is how we address really harm of maltreatment, is lagging behind the frontier, and the frontier is often being pushed in the wrong part of the frontier. So there's 2 steps we have to take practice to the frontier and get the right part of the frontier to push out. And that's kind of the vision of the Center for Social Data Analytics. So thank you very much, and I'll leave it to Mark to say the final farewells.
Thank you, Rhema. And thank you to Rhema, but also to Deanna and Gayani and Ola and Chris for really telling us about your work. I would like to endorse the comment made by one of the questioners. You are all brilliant. And I think you have given us all a very, very clear sense of why the possibilities offered by ethical data science are so compelling. Why they're so important, why they're so interesting, but also why bringing a kind of an ethical framework to all of the work and embedding that within it rather than simply adding it on in the end is really critical in these kinds of applications. So I'd like to thank all of you. I'd like to thank all of you, our audience, for coming along and for your contributions to this panel session. This has been part of a series that we have run for Social Sciences Week. Excuse me, and we've been delighted by the engagement and the participation. I'd also like to thank the staff in the Faculty of Humanities and Social Sciences, the Institute for Social Science Research and the Centre for Social Data Analytics, who have really supported us through this webinar series today. This one in particular, I'm sure you all picked it up, has actually been run across 3 countries and 3 separate time zones. It has gone seamlessly, and I think that's a tribute to the professionalism of the staff behind the scenes who've helped us to set it all up. There'll be a recording of this webinar along with all of our Social Science Week events through the YouTube channel for the Faculty of Humanities and Social Sciences. So you can view this one again. You can also catch up on other ones that you might have missed. Our other webinars included a discussion of our Australian Research Council Centre of Excellence for Children and Families Over the Life course, and a presentation that we ran with the School of Social Sciences in the university here on an investigative tool for triaging cybercrime notifications. So if you're interested in either of those things, I'd encourage you to have a look at those videos as well. So once again, thank you very much to everybody who's been involved in this for coming along today, and please stay safe through these difficult times.